Thanks, Tina. So I'm just going to see if I can get my screen to change. And it's not changing.
Can you click on the screen, click on your PowerPoint slides, and then try moving
Ah,
through with your, there we
Thank
go.
you. I know it was working sometimes and not other times.
Yeah.
Thanks for introducing me and for introducing Chase. And then I just want to talk about the outline of presentation today. I'm going to do a very high level summary of the health risks associated with climate change and a very brief mention of our climate change goals and emission sources in Canada. Then discuss some of the climate solutions that provide immediate health benefits, discuss very briefly climate change, the intersections between climate change and COVID-19, and then discuss the ways in which public health professionals can and do engage in the climate change issue. And then I want to introduce you to the climate change toolkit for health professionals that I did produce last year for CAPE, the Canadian Association for Physicians for the Environment. And I will just note that throughout this presentation, I've often just referred to the module at the bottom rather than listing all the references. A lot of the references are in each of the modules that I'm speaking to. So I've just put that in where just kind of for ease so people know where they can find the references if they want them. So first of all, and I don't want to talk about global health. Probably people understand that every one of the slides I'm doing today could be a whole presentation. So I'm going to skim the surface on a lot of things. But before we talk about climate change impact in Canada, I want to just kind of put it in the global context because climate change is already creating a crisis for global health. We are very lucky just by geography in Canada and because we're a wealthy country and we've got good municipal and public health infrastructure. We are not feeling the impacts of climate change to the same extent as other countries. So I just kind of want to put that out there and so that we keep that in mind. I think all of us, we'll see articles that talk about China having thousands of people dying from heat waves. We'll hear about India. They lost 2,000 people to heat waves in 2015. Puerto Rico, Hurricane Maria, the news reports are that there were nearly 3,000 deaths from that hurricane. So we know that there's these impacts around the world. We hear about refugees from some countries where people don't have enough food and they can't get enough drinking water. So what I'm going to do is just touch on a few little indicators just to kind of bring that into relief. So the Lancet, which is the prestigious medical journal, they now have one supplement a year that comes out that's dedicated to climate change, and it's called the Lancet Countdown on Climate Change and Health. And they've working with 24 academic institutions around the world. They're collecting data from 196 countries, and they've identified 41 indicators. And the indicators touch on health impacts, on mitigation impacts, adaptation policies, and media and communication. So they touch on those 4 different areas. And each year they kind of come out with this one report that's kind of been produced by kind of these scientists, these health scientists. And in 2018, the report came out and it said that the year before, there were 712 extreme weather events around the world, and that the cost of those events was about $326 billion. So just to kind of keep people reminding, I mean, often what we hear in Canada is we can't afford to make changes, keeping in mind that in one year, the extreme weather events around the world were costing $326 billion in economic losses. The one indicator that I found really helpful just in terms of the human health impacts is that they found that in 2017, they estimated that 157 million more people were exposed to heat waves than were exposed in the year 2000. Another indicator that they looked at was agricultural yield. For the 30 countries that were providing data, they found for all of them, there was indicators that the agricultural yield was actually maybe decreasing, and because of drought and water loss and extreme heat. So in the 2017 report from the Lancet Countdown, they actually concluded that undernutrition, or what we used to call starvation or malnutrition, would be the largest health impact of climate change in this century. So in 2015, something really wonderful happened, and that's that we actually got countries finally to kind of sign on to the Paris Agreement on climate change. And just before I kind of address that, I'll just say that the impacts that we're seeing around the world in the last number of years are happening while we have global warming hovering around 1 degree. And with the Paris Agreement, the agreement by 195 countries was to hold global warming well below 2 degrees and to pursue efforts to limit global warming to 1.5 degrees. And the current predictions are that if we continue to emit greenhouse gases at the rate we're doing at present, that we could be exceeding 1.5 degrees of global warming within 10 years, and that we could be reaching 2.6 to 4.8 degrees of warming by 2100. Now, 2100, it won't be in my lifetime, but it will definitely be in the lifetime of my children. And the researchers at the Lancet are saying, if we're looking at global warming in that range, we are talking about a planet that is no longer habitable for humans. So at the Paris Agreement, I think what happened is that they kind of went to there with this understanding that they were going to agree upon 2 degrees of global warming as the goal, and that a number of scientists, climate scientists, came to the table and said, no, that's not enough. We have to go further. So out of that, what happened is the Intergovernmental Panel on Climate Change came away, and they prepared this 800-page report with scientists from all around the world, and they examined what the impacts of 1.5 and 2 degrees of global warming would mean for human systems, for ecosystems, for human health. And they had many different indicators, and they were qualified, and with each one, they kind of indicated how much how strong the evidence was for each of those impacts. What they described was that 1.5 would amplify all of the effects that we're seeing now at 1 degree of global warming, and that 2 degrees would be so much greater. And it's hard to kind of convey, but when you read, and I didn't read the 800 pages, but I did read the summary report that was for policy people. And when you read all the different indicators, things like, coral reefs around the world will be destroyed, ports will be destroyed. One of the indicators for human health was that they said that several hundred million more people would be exposed to climate-related risk and poverty by 2050 at 2 degrees of global warming than with 1.5 degrees. So what they're trying to kind of convey here is that we're talking about something that we might call exponential in terms of the impacts, that the difference between 1 and 1.5 is huge. 1.5 to 2 degrees is that much greater. And we're actually talking about, when you read the report, it sounds catastrophic. So the Intergovernmental Panel on Climate Change, concluded that we really should limit warming to 1.5, and that in order to do this collectively around the world, we would have to cut climate emissions by 45% by 2030, which is only 10 years away now, and to net zero by 2050, which is only 30 years away. So what we're talking about here is a transformation of our economies and our societies around the world. It is huge, the changes that would be required to do this. Now, many people feel that Canada should do much more because it is one of the top 10 emitting countries in absolute terms, and we have been for decades. The other, I think many of us, climate change is the ultimate environmental justice issue. The richest countries are the ones emitting the greenhouse gases, and the poorest countries that are already struggling to feed their people are the countries that are hardest hit by climate change, and yet they're the ones that are emitting the fewest greenhouse gases. So many feel that Canada and other countries like Canada that are both wealthy and that have been top emitters should actually move more aggressively towards these goals than other nations. So when we look at the health risks for Canadians, and first of all, climate change is increasing the frequency and intensity of heat waves or extreme heat for all of us. We can see, if you look at this graph, which is based on data from the Prairie Climate Center, that what you can see is that from the time period that ended in 2005 to the time period that we're just entering now, we're looking at a double or tripling of the number of days with temperatures that reach 30 degrees or higher. And I'll just go back to say that we don't really have a good indicator for heat because it varies depending on the time of year and whether or not people have acclimatized and the duration of the heat and whether there's humidity. There's a number of factors that influence how we're affected by heat, but the number of days over 30 degrees isn't a bad indicator, something that we can all relate to. Um, I know, for example, in 2018, that was the year that Toronto actually had, in downtown Toronto, when we look at the weather station, there were 21 days that year that had temperatures that were 30 degrees or higher. So if you think about that, 21 days compared to what it used to be, which was maybe 10 days before 2005. And it's predicted that for Toronto, again, this is business as usual. If we continue to emit greenhouse gases at the current rate, that City of Toronto could be looking at 55 days that have temperatures of 30 degrees or higher. Now, extreme heat health impacts include premature deaths, heat stroke, aggravation for heart and lung conditions, and kidney conditions. It can also increase stress and violence, and there's some studies that suggest that extreme heat can actually affect the outcomes of pregnancies. So climate change is increasing air pollution. Higher temperatures increase smog. Warmer weather increases more pollen and spore production. It's wildfires are producing, or forest fires are increasing air pollution as we get smoke kind of blanketing communities. Dust storms and wind can also increase air pollution. And again, an example from 2018 when we had hundreds of fires happening in BC, 600 at one time. Millions of Canadians were exposed to air pollution that was rated as high risk or very high risk for days at a time. And so that was Vancouver and Calgary and Edmonton, and that would probably go for a number of communities surrounding those communities. And again, air pollution continues to be a significant burden of illness for Canadians. Health Canada estimated last year that air pollution is responsible for over 14,000 premature deaths per year. And we know with that with air pollution, we're talking about a kind of a pyramid of health impacts. So premature deaths is the tip of the pyramid, and then there's a number of other health impacts that are greater in number in that pyramid. So climate change or changing climatic conditions are more conducive to the emergence and spread of vector-borne diseases. And so, for example, Lyme disease, we didn't really start seeing cases of that until 2009 when we had 144 cases, and that has now increased to over 2,000 that were reported in 2017. And Lyme disease is a disease that can be quite severe if it's not treated, like caught and treated on time. Right now, Lyme disease has spread to several different provinces, and West Nile virus is another example. Now, West Nile virus did seem to peak and seems to have come down a little bit, but it still continues to be a concern in several provinces across the country. And since 2002, when it was kind of first reported, there have been over 6,000 cases reported. Climate change is increasing the frequency and the intensity of extreme weather events. And so over the last 10 years, there have been 195 disaster level extreme weather events in Canada. And just to get a sense of how this is impacting, Canadians, over the last 40 years, over nearly 500,000 Canadians have actually been evacuated because of wildfires. Floods are considered the most common and expensive natural disaster in Canada. And again, just as an example for what that might look like, in 2018, New Brunswick, the flood of the St. Johns River, it took out 150 roads, culverts, and bridges. And people down in New Brunswick talk about, for some people, they were actually kind of cut off from medical services, from grocery stores, from pharmacies for weeks until some of this infrastructure was repaired. Droughts are now impacting farmers in Canada and creating quite a bit of stress and financial stresses as they kind of struggle with the timing of kind of changing between droughts and then very extreme rainfall. And then as well with storms, for example, we had winter storm in 2018 that left 600,000 residents in Ontario and Quebec without power for an extended period. So we're talking about impacts now. The health impacts are not all that clear, but the fact that these events are happening to people and these are events that can be associated with health impacts. So we know that climate change can reduce food and water security. And again, we already know that a number of Canadians live with food insecurity. We also know that a number of Northern and First Nations communities are under drinking water advisories already. And yet we expect with climate change that melting permafrost will reduce access to traditional foods in remote communities, that unstable ice roads might interrupt food supplies in the north, and that with extreme events like the flood in New Brunswick, that we can actually get people cut off from fresh food and water supplies. So climate change can increase food and waterborne illnesses. Again, these are illnesses that already are responsible for a significant burden of illness in Canada. But we know that with power outages, like the one we described for Ontario and Quebec, that we have, we could have people eating food that might be going bad. Floods can contaminate drinking water and crops with, both biological organisms, but also with chemicals from industries and that are affected by the flood. Algal blooms that are now increasing in their frequency can actually increase the risk of shellfish poisoning. Heavy rainfall can contaminate water supplies, and melting permafrost and droughts can contaminate water supplies in different parts of the country. So the other health impact, and I think that for many of us, we feel like this is actually happening, that climate change is certainly producing adverse mental health impacts for Canada. And a number of the studies, this is an area that needs more study, but the studies that have been done suggest that extreme weather events can produce post-traumatic stress disorder, anxiety, depression, and substance abuse. That was certainly seen for people in Fort McMurray and for high school students in Fort McMurray with one study. Climate variability and incremental changes can lead to anxiety, depression, suicidal thoughts for people who are really worried about what the future holds for the world. And then the threat of future climate related disasters and current climate change risks and perceived threats can cause emotional distress. And so again, when they looked at Fort McMurray and they kind of looked at the risk factors that were associated with anxiety symptoms, it seemed to be witnessing the event and the media coverage related to it, and then also being evacuated and relocated. And you also hear this wildfires, families being separated from one another as they're kind of airlifted out of their communities, and then not being able to reach their family members. And that there seems to be a lot of that these situations are very stressful for people and cause a lot of ongoing stress. And then a study that was conducted in Labrador with an Indigenous community, people there were talking about how they could see the impacts already on their infrastructure and their food security and their way of life and their landscape. And again, this is just causing a lot of stress for people and distress as they kind of feel like the world that they've known is changing, that the world that their way of life is built around is changing. So climate change amplifies the health inequities and vulnerabilities in our society. Some people refer to it as a poverty multiplier. Um, Certainly the people that are most sensitive to some of the health, some of the impacts presented by climate change can be older people, people with pre-existing health conditions, and very young children are more sensitive. Hi. Um, so that those groups of people are more sensitive to things like extreme heat, to air pollution, to toxic exposures, infectious diseases. And then again, as kind of alluded to in the last slide, Indigenous people and those in northern communities are seeing their way of life and the impacts of climate change much faster than us, partially because temperatures are actually 3 times, they've already seen temperatures increase by 3 degrees up in the north, but also because it is disrupting permafrost and ice roads that they depend on, and impacting the way of life for people there. But the other major group that's impacted and that where we're seeing kind of the health inequities and vulnerabilities amplified is people who live on low incomes. And if you think about this, I know there was a study done in Toronto by Toronto Public Health several years ago, and they found that in Toronto, many of the low income populations actually live in high towers, tower apartments. And many of those apartments don't have air conditioning. They don't have access to pools. They don't have great access to green space. And so you can have kind of these these risks kind of being overlaid on top of each other. We also know that people who live, on low incomes are often at greater risk for many different poor health outcomes. So you have people who might already have compromised health who are then being exposed to extreme heat and then may not have access to air conditioning or cool air or cool spaces to cool themselves. Um, and then when we look at, and I have to say, in Canada, I've not seen too much around the composition of how how climate change is impacting people of color and Black and Indigenous people, except for kind of the far northern people. But there are certainly studies in cities like Toronto that have demonstrated that poverty and low income is racialized. And then there are other studies that say that low income populations are at greater risk and of climate change. So I think we can assume that there's greater risk for people of color across the country and at least in some communities in the country. So we kind of just pull back again and say, okay, so what is our contribution in Canada? What are the emission sources in Canada? What you can see here in this graph is this is a trend line for the last 26 years and or for a 26-year period. What you can see is that oil and gas is the blue. So this is not the use of oil and gas. This is us kind of fueling our cars or heating our homes. This is the extraction of methane, and this is the extraction of oil. That sector is actually responsible for 26% at this moment of our emissions as a country. And what you can see is that that's been steadily rising for what is that now, 25 years, and that it is projected to continue to increase. So this is a real problem when we have to be cutting our emissions by 45% within 10 years. That's a real problem. The other sector that's responsible for a huge amount of our emissions is the transportation sector. And you can see there, that's the brown line. Again, it's responsible for a quarter of our emissions. Now, the good thing with transportation is it's projected to come down, but not nearly enough. And that's because we have new fuel standards and that kind of thing. They're kind of coming in as the fleet kind of turns over, but that really has to change. And then what you can see with the red line there, that's the electricity emissions. That's from, generating electricity across the country. And you can see that that trend line is actually coming down, and that's because we phased out coal plants in Ontario, and we are now phasing out coal plants in Alberta, and that the line is coming down because it's projected to continue doing that because we actually were able to get regulations from the federal government that would require the phase out of coal plants across the country. And the reason it stays above zero is because they are allowing natural gas plants to replace some of those coal plants, and that's something that we would have to look at, and it would have to kind of be eliminated by 2050. When you look at buildings and heavy industry and agriculture, they all hover around 10 and 11% right now. And I think that surprises a lot of people. Heavy industry is an important source, but so are buildings. And so that's just us heating our office buildings and our homes with natural gas and I guess for some people maybe with oil, and then the agricultural sector as well. So when the Lancet, before the Lancet came up with the countdown reports on climate change, they actually did two commission reports. In the first commission, they said, "Oh my gosh, climate change is this, this it presents a huge threat to global health. It's probably the greatest threat of this century." And the second report came out and said, "Oh, the solutions to climate change could actually be a huge benefit to global health." And the four areas that they identified where there would be huge, significant and fairly immediate health benefits associated with kind of the actions needed to address climate change was around renewable energy, sustainable transportation, energy efficiency, and sustainable agriculture. So for me, this is the place where we as public health people, I think, can be very powerful because these are this is a lot of these things, these solutions to climate change actually kind of overlap with things that we want from a policy perspective to improve public health. So just looking at air quality again, so Health Canada, when it looked at the health impacts, they costed them in 2019, the health related costs associated with air pollution at $114 billion per year. So that's huge, and that's kind of a benefit that should be kind of fed into some of these when we weigh kind of what the costs are for changing over some of these bringing some of these policies into being. So again, when we look at some of the climate solutions that reduce air pollution, public transit, that's known to reduce air pollution, cycling, walking, creating transit supportive and walkable communities that foster and encourage people to use active modes of transportation. The electrification of vehicles, cultivating renewable energies, bringing in energy efficiency standards, building code standards, energy retrofits to existing buildings, and then reducing the extraction of oil and gas. Again, oil and gas doesn't just emit greenhouse gases, it actually emits substantial quantities of air pollutants and air toxics. So then we look at increasing physical activity. And again, as public health professionals, we're aware of the fact that physical activity has all kinds of human benefits for human health, improving mental health and fostering development, reducing the risk of many different chronic diseases. And one estimate from 2009 was that physical inactivity is costing us, a health-related cost associated with physical inactivity is about $6.8 billion per year. Again, substantial benefits that could be won if we could actually increase physical activity. And then again, if we look at some of the climate solutions that foster physical activity, what we can see again is the use of public transit, which usually involves walking or cycling at one or both ends of the trip, cycling and walking as modes of transportation, walkable and transit supportive communities. Again, if we design our communities so that they encourage and foster that kind of activity. And then shifting diets towards plant-based proteins. Again, we know that obesity is a real concern in kind of the modern world and certainly in Canada, and that's associated with chronic diseases and premature deaths. And again, the health-related costs associated with it have been estimated to be 4.6 to 7.1 billion dollars per year. And so again, these are savings that, if we consider the health benefits at the same time that we're looking at the climate benefits when looking at policies, that would be beneficial. So again, the journal The Lancet, they actually had a commission that was directed at food, and that commission actually came up with some recommendations. And they said that if we were moving our diets towards plant-based proteins and kind of reducing the amount of meat that we consume and red meat and increasing the amount of plant-based protein that we rely on, that we could actually reduce global mortality by 6 to 10%, but we would also be reducing climate emissions that are related to food by 20 to 70%. So again, this is kind of a nice overlap between the two. So just changing topics entirely, I've been kind of trying to think about what COVID-19 means for climate change. And I think, first of all, we've all kind of seen studies coming out in the news about kind of the places where the health risks are going to be possibly amplified or some synergies in an unhealthy way. Certainly, there's been one study that has suggested that air pollution may increase the risk of contracting COVID. I don't know if that's been substantiated, but there's one study that suggests that. There's been another study that's suggested that air pollution increases the death rates from COVID. Extreme heat, people have suggested it's likely to worsen the impact of COVID, and likewise with wildfire smoke. Now, this all makes sense. Air pollution, heat, wildfire smoke, they're all going to impact kind of the systems that are impacted by COVID. So, it's going to be a greater stress on those organs in the body. It makes sense that there could be some sort of synergies in terms of the impacts and amplifying of those impacts. And again, we would expect that the impacts would be amplified for vulnerable populations, which is what we're kind of seeing with some of the studies coming out of the United States. Um, I think for me too, it's that like right now we're coming into kind of what's kind of climate change impact season for us in Canada. We have floods in the spring, we have wildfires in the summer, we have extreme heat in the summer. And for those, we have some programs in place. And a lot of those programs, evacuations, cooling centers, we have to think through how do we protect the clients? How do we protect, our residents who are having to use these services? And how do we protect the workers and the volunteers? So these are probably questions that some of you on the phone are having to tackle or have already tackled. In terms of climate solutions, I think for me, the one that worries me the most, because I think public transit is such an important part of the picture, both in terms of air pollution and climate change, and in terms of social equity, just making services and available to all different groups of people in society. Really concerned about what COVID's doing to public transit. And I think for all of us, worried about the funding that's being lost because people aren't using public transit right now, and then kind of trying to figure out what this means long term as we deal with COVID in the coming years and what the solutions will be. I know that there's been one study came out the other day and kind of, or maybe one report came out the other day and said, oh, we don't think that public transit is necessarily a source of exposure, but I think that that's probably an area for more exploration. But the other thing that people have been, I think, in public health have been struggling with is community gardens that have been, people have been promoting community gardens and parks and green space, to get people for mental health and for social cohesion. And again, from a climate perspective, anything like that that increases that or decreases the urban heat island effect. When you have community gardens and green roofs and parks and green space, that's all really good for mitigating the impacts of extreme heat. And I think this summer, again, we've had to kind of struggle with how you find that balance between protecting people from COVID while at the same time encouraging them to participate in things that are good for physical activity and mental health, etc. Looking over on the other side of the slide here, then I think on the other hand, we've also seen some things where COVID actually seems to be accelerating climate solutions and community resilience. So telecommuting, I mean, I know for me, I'd still be working at Toronto Public Health if the city of Toronto was open to telecommuting, because I live in Hamilton. And I think many municipalities, many businesses have been very close to the idea of telecommuting, and yet now we're all doing it. And I think that it'll be interesting. I think that probably a lot of businesses and communities and municipalities will actually find that that it actually worked and will want to continue doing this, even once we get things under control with COVID. I think that even things like teleconferencing, cities are building up bike lanes. Really quickly around the world we're seeing this, and I know in Toronto some people have been working to try and get bike lanes for 20 years, and they're saying they feel like they've made more progress in 3 months with COVID than they have for years. And then again, cities expanding space for pedestrians. Like COVID has made us really aware of all these needs that we have in very dense urban areas, that we need more green space, we need more space for pedestrians. And these are probably good things, and these are things that kind of support some of the solutions to at least some of the ways of addressing extreme heat with climate change. So what's the role of public health? And I know public health is very different across the country. In Ontario here, we actually operate often either independent of government or as part of the local or regional government. And I know many of the other provinces, usually you're part of the provincial government. But there's a number of things I think that people are doing, and I think there's a number of things that we could do. First of all, a number of surveys have been done, and they find that people are more likely to make changes, behavioral changes that around climate change when they know that there's a health impact associated with it. And so, and the other thing that we know from surveys is that health professionals are really trusted by the public and by the media and by decision makers. And so as public health professionals, we actually have a real role in helping people to understand climate change. And so we have community networks that we can work with, and we have expertise in doing that. So for us, some of the things that we need to do as public health, I think, is really help people to understand that climate change is a health issue, help people to understand what they need to do to protect themselves from the climate impacts, and help them to understand what programs and policies we have or that we need to protect them, when there's floods and wildfires, etc. But we also need to educate them about what they can do to reduce their impact on climate change, and also the collective actions that are needed to reduce our impact on climate change. I think, again, in public health, we understand this, that you can teach people, the importance of physical activity, but if the environment around them doesn't support and foster that, then people won't do it if their lives just don't afford them the time and space and resources to do it. So we need people to understand, if we want people to retrofit their homes, then we need programs that make it financially possible for them to do that. Collaborate with allies on common goals, and probably a lot of public health people are already doing this, but recognizing that, that some of the things that we want for public health reasons, these are often wanted by a lot of environmental groups and community groups for other reasons, sometimes for climate change, sometimes just for other reasons they want them, and kind of recognizing that we have something to bring by bringing the health co-benefits to the table. And I will say that I was involved in the coal phase out work in Ontario for 6 years. I was kind of the lead public health person on that issue in the province, working with Toronto Public Health and then the Ontario Public Health Association. And people, what we find is that the health co-benefits, talking to people about air pollution benefits associated with closing down coal plants, and then also kind of reducing mercury in fish and that can affect their children, that kind of thing resonates with people much easier than some of the climate benefits. I think for climate change, it still feels very big and overwhelming to people. Municipal and provincial processes. I know that a number of public health units across the country are actually very active right now, trying to change the built environment, make it more walkable, make it more transit supportive, trying to improve air pollution, and that we're doing this in a number of different ways. So again, by engaging in those municipal and provincial processes, we can bring health evidence to the table. We can also bring health equity concerns to the table. So we can do that through, planning processes, official plans, subdivision plans, transit plans. I know in Sudbury they were really good that they got engaged in the transit consultation plans, and they ensured that consultations were being conducted in neighborhoods that are low income neighborhoods, and they tried to ensure that that the consultation was done in a way that would be amenable to people from low income, to kind of encourage them to get their needs met in those transit plans. Active transportation plans, what I have found from our work on Healthy Canada by Design was that when we bring planning and public health and transportation planners together, that we can often have success that cannot be won by planners or transportation planners alone. They really find it helpful to have the medical officer of health on side, and to have public health arguments being brought to the table that sway the public, sway the decision makers, their city councilors, etc. And then another role that's, probably for many of you is required is that, for many of us now in public health, it's our job to decide, well, if extreme heat's a real issue in our community, then we need to have some sort of response to it. What do we do to mitigate the impacts on human health during that extreme event? And so for some of us, it might be initiating these processes, and other times it might be participating in processes that are initiated by another level of government or another department within our communities. But looking at the ways that we can kind of get involved in terms of, whether it's floods or wildfires, but there's kind of getting involved in the assessment of the risk for our community, and then there's getting involved in the plans that increase our resiliency of our community, or adaptation plans, or just response plans for those extreme events. And then for those of you who actually work with healthcare facilities as well as communities, for me in Ontario, when I've worked with public health, we don't really interact with the healthcare facilities too much, or at least I didn't in my job. But I think for some of you, you're probably working for a department that works with both public health and healthcare facilities. Healthcare facilities are very inefficient users of energy. They're actually significant contributors of greenhouse gases. One estimate has that they are responsible for 4.6% of climate emissions in Canada. And so for some people, there's the feeling that we should really be focusing on sustainability plans within healthcare facilities, trying to do resiliency assessments to see how sustainable their operations are, what products can be replaced, what operations can be improved, how they can increase the energy efficiency. And for some of these, there will actually be cost savings, and maybe considerable cost savings associated with them. The other part of it is doing vulnerability assessments for healthcare facilities. They might have to, with the wildfire in Fort McMurray, they actually had to evacuate the hospital, recognizing that, with wildfires and floods, that you might be flooded with new patients and clients, and so you need to have plans to prepare for that and know what operational things you need to be prepared to do, or what you might to be prepared for those events. So in Toronto, for example, heat waves is a real issue. We'll hear about emergency rooms kind of being kind of flooded with people during heat waves, so that kind of thing. And then the other thing is, I know for many public health professionals, it can be difficult to do advocacy because you're working for, certain level of government, and so you have to be careful about what you say. But this is where your public health associations come in. It's incredibly important that public health associations can be the place where you educate your peers, where you do capacity building and peer-to-peer mentoring. It can be a place where you do advocacy for different levels of different policies that are needed at municipal, provincial, and federal levels. And I've just got a little example here. Last year when I was working for CAPE, we actually did up a call to action on climate change and health, and we got 25 health organizations to sign on to this, and we sent it to the federal ministers, and we met with the federal minister of health about it, and we met with the federal minister of environment about it, and just recognizing that those associations are there, and they're there for you, and that you have the opportunity to kind of make use of them. So just really briefly now with the last minutes, I'm going to kind of scan through these. I just want to talk about the climate change toolkit that I produced it, but I was not the person that I did not author all of it. I edited it, I produced it. I got some funding from the Climate Action Fund at the federal government. And what I wanted was, we had a number of physician members at CAPE who really wanted to engage in issues, and we just couldn't keep up with the volunteers, the demand to kind of like, oh, what can I do? So the toolkit was kind of produced with them in mind. And so it's 240 pages in total, but we've produced, or when I was at CAPE, we produced it so there was 8 standalone modules and 7 fact sheets, and they've been translated to French, and so they're available in both English and French, and they're open access on the CAPE website, and I've got the link here to both the English and French, and you can download the fact sheets and the standalone modules by themselves, or you can download the entire 240 pages if you want. So the first two modules, one is climate change, is like just a real summary of the climate science and the drivers of climate change and the commitments, that the international commitments. Module 2 looks at the global health impacts of climate change. These two modules were authored by Alice Magushin, who actually works on the Lancet Countdown report, so somebody who really knows her stuff. With each one of these modules were actually reviewed by several volunteers at CAPE, including myself. The module 3 is climate change health risks or health impacts across Canada. This was prepared by Helen Doyle, who's a former manager of environmental health at York Region, and it discusses the health risks across the country and kind of gives case examples, and kind of does it by province. It kind of talks about them in total, but then identifies which ones are to be expected more in some provinces and territories than others. And this was reviewed by Peter Barry from Health Canada, who's been doing research on the health risks of climate change for possibly decades. So that's a really nice module, actually. Module 4, we actually had prepared by Bora Plumtree at Pembina Institute, and it looks at the greenhouse gas emissions by sector for each province and territory, and it does it with trend lines over time. And the idea being that you can actually kind of go in and see what the emission sources are for your province, your territory, what might be the most important sector to focus on. But also, if you're preparing some sort of kind of piece to take to a city council or something, it kind of gives that emissions data that kind of helps to ground it from a climate change perspective. Module 5 was prepared by Ronald McFarlane, whose name I've misspelled there, sorry. He's a former manager at Healthy Public Policy Directorate with Toronto Public Health, and I worked on this one with him. And this one discusses the health benefits associated with various actions that can be taken to reduce greenhouse gases. So this one here looks at everything from energy efficiency and extraction of oil and natural gas. It looks at some of the policies, the big picture policies like carbon taxes. It looks at active transportation, and it provides kind of the health evidence. So, today I kind of give you the high level picture, but here it's actually providing some of the evidence. And again, with the thinking that if people wanted to kind of create papers and that this would be a starting point for some of that health evidence for them. And module 6 looks at taking action on climate change at healthcare facilities. So doing those vulnerability assessments, those resiliency assessments, how to do it. And it was prepared by Linda Verengu, who is was the executive director for the Canadian Coalition for Green Healthcare. And again, kind of a case study approach, and it really draws on the experience that they've had over the last 10 years working with healthcare facilities in Canada. And module 7 was prepared by Carol Mee. She comes out of Toronto Public Health as well, former manager, and she actually had to work on um, the heat response programs, and she had to work on the cold alert programs for Toronto. So she has actually had to kind of respond to some of these extreme weather events and help develop the programs and policies to associate with them. So with this module, she actually did key informant interviews with people across the country who are having to do the same thing, developing, flood response plans, developing wildfire response plans. So it's a case study approach again. And then the module 8, I prepared this one with Alice Magushin, and it just discusses different ways that health professionals can get involved and kind of encouraging people to see themselves as influential messengers, and talks about different ways that you can get involved and the different kinds of things that one can ask for. Divestment, that, I think what I've seen at CAPE, they'd have our members would go to the CMA and ask them to divest their funds from fossil fuels, for example. Anyway, that's it. It's a very fast overview of a huge territory, but there it is.
Great. Thank you so much for the amazing presentation, Kim. I'm going to open up the floor for questions now. So we had a couple of questions come in through a chat box. Kim, if you could open up the chat box, and perhaps you could try to follow along. And let me know if you have questions seeing
Okay.
the question.
Okay. I'm there.
Okay. Okay, great. So the first question is about COVID-19. Is there any data on current immediate effects associated with drop in greenhouse gases as a result of COVID-19 related reduction of industrial producers, for example, travel, etc.?
I think what has been said, and again, and probably people understand this, it's really hard to keep up with everything that's going on in the world right now. But what I'm seeing from the news reports is that greenhouse gas emissions did drop, but not by nearly as much as people thought. And so what was kind of, I think it was kind of interesting, they did drop, and I think we all saw the air pollution improving, and we saw nature coming out, and a lot of that was a drop in people actually traveling by vehicle. But what wasn't dropping was that people were still, heating or cooling their homes, and so they're still using natural gas. A lot of businesses were still using energy. We still generating electricity, and so I know that some people were saying, "Oh, this is so disappointing that it didn't drop by more." But that's because we still had a lot of society kind of operating. It was more the travel that dropped. But what is impressive is how much air quality improved with the drop in travel, and also the greenhouse gases did drop because of the drop in travel. So I think what we have to recognize here is that we really do have to transform our society away from fossil fuels entirely. But everything I'm seeing when I follow the literature in that is that it is possible to do. What we're lacking here is the political will. And this is actually a moment when governments are making investments that they would never really make, that this is a moment when we could really transform our economy.
Thank you. So next question, if you can see in the chat box. Given that so many solutions fall into new technology and many barriers are socioeconomic or political, are you seeing greater collaborations with innovators or engineers to tackle these issues? And if not, how can we best stimulate these relationships going forward as a new viable option?
um, my sense is, and I have to say, I think that that's an area that maybe there's not enough collaboration going on, but I will say that, I do kind of follow renewable energy and green tech kind of through LinkedIn and that. And what I'm seeing, and then there was this, I don't know if people saw this, but there was this whole Corporate Nights series that featured a comprehensive analysis that was done by Ralph Torrey and others, where they were actually kind of looking at, well, with energy efficiency, we could reduce emissions this much, and it would cost this much, and we would save this much. The sense I get is that a lot of the solutions are out there, and that it's really that we are kind of digging in with fossil fuels, and that we give them so many subsidies, and that we're so committed to them that it's hard to make the shift. That's the sense I get. That I don't, not that there aren't still some holes to be filled, but the problem is that we're subsidizing the fossil fuel sector far more than that we're subsidizing the renewables and the new green technologies that are needed. But I think it would be helpful, and I think at some level it's a little awkward, I think, for we don't want to pick the industry, but I think some of us do appreciate the need to look at the good technologies that are out there and to then promote them. So whether it's like electric vehicles or something like that. And one of the examples I wanted to give, and I kind of forgot to do this, is the OPHA actually recently, over the last year, they collaborated with Environmental Defense and the University of Toronto, and they did some modeling around electric vehicles. If they kind of looked at, the premise was, if all the vehicles, all the cars and SUVs in the Greater Toronto and Hamilton area were to shift to electric vehicles, what would it mean for air quality and climate change? And what they found is that it would actually avoid more than 300 premature deaths per year in the Greater Toronto and Hamilton area. So I think that that's the kind of thing that we can be doing, is kind of helping to bring out the health benefits associated with some of these shifts.
Thank you. Okay, so next question was actually sent to me privately, so I'll read it out to you, Kim. Without undermining the importance of fossil fuels in greenhouse production, what is needed upstream to address the contribution of agriculture, estimated to be responsible for about 1/3 of greenhouse gases?
I have to say agriculture is an area that I'm unfortunate. I just don't know very much about the agricultural sector, so I feel like I can't really answer that. And I have to say again, the numbers, I keep seeing these numbers for agriculture's contribution. In Canada's records, they talk about it being about 10 or 11% of our greenhouse gases, whereas I know that sometimes people do talk in bigger terms. It depends how they're doing their numbers, but I'm afraid that's just a sector I'm just not very well informed about, so I'm not going to speak to it.
Great, thanks, Kim. So let's see, are there any other questions? Looks like, so thank you, Pema, for sharing the resources from NCCDH, our sister NCC. And the rest are, so I did share a link here to the climate change toolkit for health professionals that Kim went over at the near the end of the presentation. Don't see any other questions. Feel free to type in more questions if you have more, or reach out to Kim directly if you have questions for her. Um,
One of the things maybe what people are thinking is, I'll just say, if we've still got the time, is that right now, for example, there's standing committees at a federal level that are actually looking at, what is the economic recovery plan for COVID. And so many of us are working across sectors to really kind of say, we really need to address health equity issues, we really need to address climate change, and we really need to address people are coming up with policy statements together, and one of the positions was that we should really make certain that the money is going into the hands of people and communities, and that we're not necessarily giving the money to corporations that might just be used to kind of make the company stronger, but that doesn't necessarily create jobs. So people are talking about, we're kind of using this as an opportunity. And I will say that we put in a submission. We didn't have a lot of time to put together a submission, but I did kind of work with the CPHA and the OPHA, and we did put in a submission to that standing committee this week. And then we did an op-ed that was actually picked up this week at the Hamilton Spectator. So that's the kind of thing, when we talk about, there's a moment right now where our government's looking at spending billions, perhaps trillions, to kind of really get our economy going. It's a moment when, we're afraid that what they might do is just double down and support the existing economy the way it is. And I think what we've seen with COVID is the way it is not sustainable, both in terms of climate change, but also in terms of the health inequities. And so I think people are saying this is a moment when we could really address some of those issues.
that's great. Thanks. Oh, one last question I think came in. Are there any considerations for rural versus urban public health unit department roles and opportunities?
um, are there any considerations? Certainly in the module on health impacts, we do look a little bit at rural versus urban, and then we, like things like water quality would be a greater concern in a rural area, whereas in the urban core, extreme heat is more of a concern, that kind of thing. But I do know that I think the OPHA did actually produce a toolkit looking at climate change from a rural perspective. I'm afraid I don't have the name of that, but that might be something that maybe you guys could make available to people.
Thanks, Kim. I don't think there are any more questions coming in. We have about 5 minutes left. Maybe we'll give a couple more minutes just in case people are still typing.
I was afraid of rambling. I tried really hard to keep it tight. Uh,
Pema just mentioned that there is a public health summer school coming up. Oh, another question. So in terms of convincing municipalities to spend their money on GHG reducing infrastructure, for example, active transportation networks, what's the best way to educate them on the benefits? For example, lower healthcare costs when they won't see the financial benefits directly.
Yeah, I think that's a real concern, but I have to say, so I don't know if folks are familiar with the Healthy Canada by Design CLASP initiative. It went on for 5 years. I was involved for the last 2 years as one of the co-managers, and what we had there is we were actually trying to get public health units to work directly with the planners within a community. So in Halifax, for example, they actually did develop an active transportation strategy together, and the planners were actually saying to public health that they had tried for years to get something like that in place, and they couldn't do it until the medical officer of health and the public health department came in. And part of it was just public health coming in and talking, even if they weren't creating health savings for the city itself, but just coming in and talking about all the health benefits was really helpful, that the decision makers, the city councilors, were kind of moved by that. So I think recognizing that even though there's not always a nice kind of synergy in terms of, yeah, the savings are happening at a provincial or federal level when the expenses are at a municipal level, but it's still really important to bring that stuff forward. And people did find that when municipal and when planners and public health are working closely together, that can be very effective. And I personally have seen that myself in the city of Toronto, in Halton Region, and I think there's many public health units that would say the same thing. And one of the things I just point out, not to be self-serving here, but actually in 2009, I actually did a report called where I actually interviewed 10 different public health units in Ontario and asked them how they were trying to engage in the built environment and land use planning processes. And it kind of I interviewed them, I looked at all the reports, and then kind of identified the many different ways they were doing that. And it was something that I did through the OPHA and the Clean Air Partnership. And I've been told by various people they found that helpful because it's kind of capturing the voices of public health professionals that were actually doing it in different health units, and they all approached it quite differently. And it was kind of interesting to hear that the different strategies that worked in some like in some public health units versus others. I mean, I think people might find that helpful.
Thank you. One last question. What are your thoughts on how climate change connects with the current crises in environmental degradation? Example, plastics, pollution, biodiversity, and how can we help to address these really broad overlapping concerns?
I know this was a really complicated one. My understanding is that when we look at COVID, that what we're and COVID and other infectious diseases like that are kind of emerging, that a lot of it is from us encroaching on natural habitat and also destroying biodiversity. So at some level, those two things. I mean, I know there's also kind of the whole market thing of bringing wildlife into markets and then killing them in the market, and that kind of thing contributes to it. But I think what people would probably say is that from a climate change perspective, destroying biodiversity is not a great thing, and that in terms of infectious diseases, there kind of amplifies the health impacts with infectious diseases and the health impacts of climate change. I don't know that they're directly related, but they're all a big picture. I think all of us right now feel that we need to address biodiversity, we need to address climate change, because we're actually destroying the ecosystems upon which all of us are dependent. It's like in our modern society, we've lost track of the fact that we are actually part of these ecosystems and that we depend on them for everything. So I know that's a little bit of a mushy answer, and I'm sorry I can't give a better answer right now.
Okay, thanks, Kim. So one more question. We have 1 minute left from Lydia. How do you think we as public health can and need to do to keep focus on and scaling up climate change mitigation adaptation efforts while COVID-19 gets much of attention and resources right now?
I'm not quite sure because honestly, I feel like I'm
Mhm.
suffering that myself. I've
Yeah.
applied for a few funding proposals that have been turned down, saying, great proposal, but we're focusing on COVID right now. I think it's a bit of a problem because I know that public health is really stretched across the country, and that when you have something like COVID, it's like all hands on deck. So that is a problem. But I do think this is a role for our associations. And I would say to people that, that I think, if you feel like you don't have time to do it through work, if you can kind of get, work through your association to just keep it out there in the public, kind of keep it in the media. I found out, I was surprised over the last 4 years at Cape, we ended up getting 53 media hits one year. And that was just doing a few press releases here and there with quotes. And, if there was a heat alert, kind of drawing people's attention to the fact that this is climate change. And when there were wildfires, and trying to do little op-eds and that. So Cape was a very small organization with 3 staff at the beginning. When I left, there were 5. But I was surprised that Cape, we were actually able to get so much media attention, but I think it's because the health arguments are very compelling and people really need to hear them. Personally, I'd really like to see public health doing the same thing because I feel like we have so much expertise to offer. And so I'm not quite sure how to do that. But I think just even encouraging people to kind of recognize, I think sometimes in public health, we're modest and don't recognize how much we have to say and how important it is for the public to hear, our views on these things.
Great. Thank you so much, Kim. And I think thank you to all the attendees for attending the webinar today. I'm sorry I couldn't get to all the questions, but if you have more questions, please feel free to reach out to Kim directly. And thank you all and have a great rest of your day.
Thank you, Tina.